Guten Tag. Ich bin
Hallo?
Josef.
Ja.
Und? Also reinkommen?
Ja.
Bitte. Suchen kann, ne? Bitte sitzen Sie. Sagen Sie bitte, was ist passiert?
Gefallen. Sturz.
Auf den Boden? Und?
Auf den Stein. Und es schmerzt. Es tut weh.
Ist heute passiert oder gestern? Oder ist es schon so seit einigen Tagen?
Vor einigen Tagen.
Okay. Wie schlimm ist es jetzt?
Hello, Dr. Joseph. How are you doing? Nice to meet you today. Congratulations.
Thank you.
This was your first day today as a freshly baked, as we say here in German, freshly hired young postgraduate doctor, Assistenzarzt. When you arrived this morning, what happened first? How did they greet you? How did they introduce you to your new job, to your new colleagues?
Yeah, the job over here, it starts by 7:30. We actually come here by 7:20. Everybody reaches here by 7:20. The professors, the chef arts, everybody comes by that time. They start with the visit. The first day started with everybody greeting me, congratulating me first to get the job and to be around with them. Second thing, to get used to the system here. For that, I had to go through a little bit more paperwork here, which is actually the normal Papierkram here in Deutschland. That's what they say. But and then they started with the visit. We had rounds. We had operation too, where I actually assisted. And that I find is really good. The first day when they actually let you hands-on experience, that is a wonderful thing. That means they actually respect you. They actually find you as a good person to get around with. And then skillful way, I find it is also good over here because they actually explains everything through and they make you feel so comfortable that you don't have to be so nervous thinking that, okay, it's my first day, will I be embarrassing? But honestly, never had I thought about it. And by the end of the day, I find myself actually on the best hands. Yeah.
What made me really proud of you as one of the graduates of our course, that you managed to get a job here in one of the really very well-reputed hospitals. How did you manage this?
But I find it's maybe, from my aspect, it is because of the integration that I put myself through. Because from the very first day I thought I have to put myself into the people here. Be like them, walk like them, talk like them, be one like them. For that I have to put all my aspects of my belief outside and rather respect their belief. That's you're respecting them in turn. It's like a boomerang. That's how their respect comes back. So it actually helped me a lot from the very beginning. Integration doesn't actually mean that you actually have to do everything they do. It actually means that you respect them, respect their language, learn them, be a part of them, and be yourself really flexible. And that actually did show a lot in my interview. I think that helped a lot, the confidence that I had by that time. By so many months here, I got a lot of confidence through. I went through a lot of people, made a lot of friendship, and that actually helped me with the interview. When I was sitting in the interview, I think that confidence actually reflected and it helped me through.
And how did you learn about the importance of integration?
Yeah, the first time when I came here, it is the first thing Frau Dr. Petreit, she actually said to us, it's not only about chasing your dreams, it's also about being a part of the society too. That we are not here to just do our thing and just exploit whatever you're getting here. It's also that you have to be integral. You have to be an integral part of the society, a part and parcel, and help them too. It's like you're doing something, you're helping them, and they're helping you back. That is integration. And that she had told me, not only to me, to everybody from the very first day. Go out, be with the people, talk to them, and that is integration. Where you actually learn to be one of like them.
And how did you come to Germany in the first place? Tell us about your story.
Long story cut short. It's actually, I had in the very beginning, twice I had rejection from the visa offices because I had tried myself through language office once. I tried through an agency which was actually not so reputed. They were actually blacklisted in the embassy. That's why I had the second time also rejection, which made me actually very sad. I thought that I would never get through this. That's when I met, I didn't meet actually, that's when I heard of Mr. Ashok in Niche Education through one of my friends. Also he and many of others who already got a job here in Germany because of Mr. Ashok. Then I thought, okay, why not I start up with him? I never met him. I never met Mr. Ashok, but personally, we only had phone conversations. And through these conversations, I put my trust on him, and there it started. That's how the journey started. And from there, I got to learn Frau Dr. Petreit and Frau Mariana. And actually from there, they assisted me from the very first steps. It's like, you're a baby and you're trying to grow up into the society here. So it's like they just push you. They're not like the people who actually spoon feed you and you'll be like, oh, I gotta do this, how can I? No, they actually just give you advice and you've got to run it. It's like you got to run your race. It's not like everybody is there every time to help you out. You gotta do it. And they actually advised me through the visa procedure. It went very smoothly. When the agency has a good name, everything is, also 50% is sorted out there. The other 50%, the agency had already educated me. It's like education itself. They have educated me what you are, what do you want to do. It's not like they artificially prepare you for some questions. They make you understand what you really have to do here in Germany. What is your role in this agency and what you have to do further, for which you will be quite prepared, you'll be well educated what you have to do. So when the question comes, it's like you're answering from yourself. It's not like you just learn something and just split it out. That's what I found helped me a lot with the embassy.
Tell us a little about the e-lessons that you received before.
I had quite a lot of e-lessons which I had to do every week. And this e-lessons actually helps you to get integrated with a lot of new systems, like how to use connections for train, how can you use that app just to know which connections you have to take. And what is the system of throwing a dust, not dust, you're using the dustbins, because here there are a lot of dustbins, different colors.
And how was it when you arrived here? What did you do through the first weeks, the first month? Walk us through your time here until the moment that now you're sitting at the desk here.
Also the thing, from the very first day when I reached here, the climate. And it's for me, I'm coming from a really, really hot country. And when I come here, it's like -2, -3. It's like totally different. Then from that to the transport system. Transport system was okay with me. The language, B2. I started with C1 language here. I came here, we started directly with the C1 language here, which I think is really, really important. Because everybody says back at home, B2 is enough. You can just get into anything. To be very honest, I find B2 is just basic. Like you can actually talk to people, you can conversate, you can do your daily things. But to be really good in your language, to actually, what we say is, when you actually master the language, it's like you can joke with the people in their language. And that's what C1 helps. That's where the people actually think you, wow, how long are you here? Are you here for 3-4 years? Wait a minute, I'm here just for 2 months. And that's where you find the difference between C1 and B2. And the next thing, after C1, we were advised by Dr. Petreit that we need to go out during this time. It's not just simply sitting at home, learning and learning. It's more about manifestation. It's like manifest yourself more outside of the people. When you talk more, your language becomes better. At the same time, you learn the people, and the people learns you, and you will know your faults. And you learn what all simple mistakes that you make, the embarrassments that you go through, which you find them as embarrassment, that makes you as a better person. There were times that there was times at parties, like not, when you were invited for a house party by good friends, then there will be some small mistakes that you make, and that you keep in your head and you learn it. So the next time you do it, you make it better. So these things actually, simple word for this, integration again. After C1, we went through this procedure of going out, meeting with people. It's not only for C1, it's for the every day routine. And then we had this medicine Fachsprach course, that is we learn the medical language, we learn how to take history, we learn how to give the history, to how we convey the history to the doctor, to our chef hours, which is very, very important, because when you work in a hospital, you don't have time. The doctors, they don't have time for to waste, to teach you everything from the very beginning, which you are supposed to do with the uni. So they find it more respectful when you actually know all these things, and when you come into the system, they find it easier to convey things with you. That helps with the medicine Fachsprach course. Then you have to do an exam for it. Then we had so many courses at the same time. We had hospitation, and we were supposed to do hospitation for 1 month, which I think is very, very important. You have to know the system here in Germany, because the system in India is really different. Every system has its own importance. At the same time, here in Germany, the system is really different, that we have to learn a lot of terms, really get at least a little bit. I know 1 month is not enough to be great enough, but where you can actually get to know a lot of things through that, where you can actually show yourself that you know the system, where you can actually make it feel easier for you, so that people have the feeling that, okay, he knows something about it. Then we go further with Gleichwürdigkeitsprüfung, the approbation exam. That is a more sensible thing, rather than where you have to learn a lot of subjects, but it's not very hard as we think it is. Once you have basic knowledge as a doctor, you have a basic knowledge, you have work experience. It's more of what you have worked, you're conveying it in a more practical way. The questions are very practical, very basic, very practical, that they just want to know, are you a good doctor? They can get and take into the system.
Could you tell us a little more in detail about this equivalency exam that you need to do in order to get your permanent license, the Approbation? Which fields are being tested, and how did you prepare yourself, and for how long did you prepare yourself?
The subjects which are quite very important for the equivalency exam, they are general surgery, general medicine, orthopedics, Rechtsmedizin. That Rechtsmedicine is actually the law medicine, which we don't have in India. We have in India, but ours is not so pronounced as it is here. Here it is very important, because here Rechtsmedicine is one as important as general medicine and general surgery.
Mm-hmm.
Then you have pharmacology. Then again, that is also very important. Then you have radiology, and then it depends on who the examiner comes. Sometimes for the preparation for the exam, I would suggest 3 months, proper 3 months, which is very much enough if you have a good basics, you have a practical knowledge. 3 months are very good enough. The 3 months, and then you have 3 months. I include 2 months of good studying, 1 month of repetition, 3 months perfect enough, and then for the exam maybe 2 more weeks maximum. That's it.
And the exams are oral, is that right?
Yes, exactly. The exam is completely oral. It will be actually not like a 5-round question. It's like more easy going, like, what do you call it? They make it like questions are more of practical wise. So like they'll ask you like, okay, there's a patient who came to you in the emergency ward. What do you do? That's how the question goes.
Could you tell us a little about the job application training that was conducted?
Yeah, We had job application training, which they kept on doing in between from the very beginning of the time you be here, which you think that, okay, why is this keeping on coming again and again in between? But it actually helps you because you got to know how the system is, what will be asked. The job training just makes you get out of your fear, because most of us will have fear facing new people, facing different people, being questioned. Everybody has that fear of being questioned. So you are brought out of your fear. So the training actually helps you, and when you actually sit in a real interview, in the end of the day, it's again interview. So when you sit not only for the interview, when you sit with a normal person also, when you're being kind of like, being fired with questions, so you know how to go through it smoothly.
What would you recommend other fellow Indian young doctors? How should they prepare themselves? What should they expect? What's your recommendation?
Everybody has different opinions. My opinion that has helped me is always getting out of the box. When you sit in your box, when you think that, okay, this is me, people has to accept me the way I am, I have to do things the way I like, that sometimes doesn't help. You got to get out of the box, which I would suggest the other fellow people, which would really help you. Like when you get out of the box, it's like you stepping into someone else's circle, trying to be one of them, respecting them. And when you do that, you see a lot of changes. Where you can actually find the difference is that, because I've found a lot of people who just sit in the box and they say that, no, this is how I am, this is how my thing is, this is what I like, this is what, no, it's no I there. When you try to be into someone else's system, you got to get into their box. That I would suggest everybody. I hope everybody understands that.
Regarding your final assessment of the agency, who has helped you? Mr. Ashok with Niche Education and we from the Bureau of International Education Management. What did you find particularly helpful about our support? And where do you see the challenges that other clients have to master to be with us, perhaps in comparison to be with some other agency who could be more classroom-oriented or who could be more spoon-feeding?
The final assessment that I would love to say is, you are not in a kindergarten. The agency doesn't actually teach you A for apple, B for bat. They give you the tools. Take the tool, run. They educate you, they give you the perfect idea of what you're going to do, and you are well aware what you got to do, but you got to do it by yourself. So it makes you more capable. I know many other agencies that actually they are helped in every single thing. And I feel that sometimes, yeah, it is good to make things easier, but it's not capability. Here you will become capable as a person. See, in the end of the day, it's not just writing the exam and passing the exam. In the end of the day, you're getting a job, and the dream job, and in a dream place. So when you get that, you find yourself as capable. So I would say, from my point of aspect, I would just say the agency made me really capable at the end of the day.
Thank you so much and good luck. I wish to have the next interview with you in 5 years when you just passed your specialist exam.
Okay. Herr Müller, danke Ihnen. Also alles gut gemacht und wir nehmen Sie auf der Station 6 auf.
Ich weiß, dass ich bei Ihnen in guten Händen bin. Medizinisch in guten Händen.
Dann machen Sie keine Sorge. Einen schönen Tag noch.